Ministries. Please go ahead. 6 minutes.
Thank you to all the witnesses for being here. Mr. Stamatakis, first to you. Of course, I live in Vancouver, where you have been had a long and great career with Vancouver Police Department. I reached out to some of your members in advance of this meeting and asked what their challenges and concerns were. And I want to read you one response I got. The VPD officer said, most of my challenges and concerns are mostly answered with just wear PPE and you're going to get it eventually. The reality of working in the front line is I'm not able to avoid high-risk interactions when it comes to COVID, and I feel like it's just assumed by the government that we will get it and to suck it up. I personally don't disagree with that assertion, but I know it makes lots of my coworkers who have elderly relatives at home much more nervous. Numerous times I've had to deal with situations without PPE, as without my immediate intervention, there could have been bodily harm or more. The current answer to that afterward is keep coming back to work until you show symptoms. Couple that with constantly having to attend SROs at an increasing rate, working in close contact with people who have drug and mental issues that make even basic hygiene out of the question, and sharing all my equipment, there is no end. I'm just wondering, Mr. Stamatakis, given that jurisdictions like New York City, where 4,000 members of the NYPD have tested positive for COVID-19 and about 15% of the uniformed workforce is out sick, do you have any similar concerns of that with respect to your membership?
Thank you for the question. Mr. Chair, that's why in my opening remarks, I tried to emphasize that one of the challenges of policing in this environment, in this very sort of unprecedented environment, is exactly what that officer that you were in contact with described to you. We often don't know who we're dealing with, and we don't know, we have little control over the environment within which we're interacting with people. So I mean, these are very real concerns, and that's why the level of anxiety for police personnel through this pandemic has been so heightened, because we try and put protocols in place to try and mitigate the risk as much as possible, whether that's through the issuing of PPEs or changing how we respond to different calls, minimizing the number of times that we might be interacting with the public where we maybe would normally interact with them in normal circumstances, but now we don't because we want to try and prevent police officers from being exposed. It's a very, very real issue, and I think the approach we've taken is to try and raise issues when they've come up. I think the approach we're taking now is we're trying to identify some of the concerns that we've had to try and look sort of prospectively to how can we address these in the future or as this thing continues. And to that end, I've had good lines of communication with Minister Blair and Public Safety Canada, who have been responsive to some of the issues that we've raised. But look, it is an unprecedented situation, and what that officer describes is what officers are experiencing right across the country. We're fortunate in Canada that we've had few officers. We've had officers in almost every jurisdiction test positive, but they haven't been significant numbers. Where we've been more challenged is officers who have been exposed and then have to self-isolate, and then you have to manage the deployment issues that arise from that. And then we manage that through, and I alluded to this in my opening remarks, the need for testing and easy access to medical professionals that can give our members good advice. And for the most part, in most jurisdictions, we do have access to advice from medical professionals that we're trying to take advantage of.
Thank you. Mr. Tanguay, Minister Blair, at a news conference said that literally hundreds of federal inmates have been granted early release in response to COVID-19 outbreak. Could you inform the committee of both how many inmates have applied for early or exceptional release because of COVID-19 and how many have been released to date?
Mr. Tanguay, your microphone is mute.
Do you hear me, Mr. Chair?
Yes, please go ahead.
I'm sorry. So I was saying that this is outside my area of responsibility, and I would take this back, and we can provide the information, sir.
Thank you. Ms. Thornton, on April 1, Federal Health Minister Patty Hajdu admitted that the federal government likely did not have enough protective equipment in the National Emergency Strategic Stockpile. To quote her, "We likely did not have enough. I think federal governments for decades have been underfunding things like public health preparedness." Two questions. Would you advise this committee that federal governments have been underfunding NEST for decades? And at any time in the last 10 years, has PHAC warned the federal government that NEST has been underfunded?
I may, in my opening remarks, I did talk about the gradual evolution of the National Emergency Strategic Stockpile. And it has evolved from wartime to current time, right before the pandemic, with various phases and various types of funding. It does not have a large budget when I look compared to my international colleagues or even with some of my domestic partners. It has been funded for what it was asked to do, however. It was not asked to prepare beyond surge capacity for provinces and territories. With hindsight, one could always like more. One would always wish that in the future, however this goes forward, as we do the preparedness and we identify the risks and what's required to address those risks, that the budget allocation is proportionate to allow us to meet that.
Thank you. I know that in
Mr. Davies, you're at 1 second. You're at your time right now. Thank you.
Thank you.